my name's Stephanie and I'm going to be your nurse today. I'm going to do a head-to-toe assessment on you, okay?
Okay. Hi, Stephanie.
Okay. What brought you in today?
Just here for my yearly physical.
Okay. Do you have any complaints?
My ankle hurts after soccer, but that's about it.
Okay. Does anything help with the pain?
I usually ice it and rest and go take a bath.
Great.
And then it goes away.
And do you have any family history at all?
My dad has high cholesterol and gets headaches sometimes, but my mom seems pretty healthy.
Okay. Do you have any medical history you know of?
Not that I know of.
Okay. Now I'm going to move on and I'm going to assess your skin for the color, thickness, and for any rashes or anything like that. Good. Do you have any itchiness anywhere or have you seen any rashes?
No.
Okay. Now I'd look at your back and I'd look behind your legs also. Okay. Now I'm gonna look at your hair and your scalp. So I'm looking to see if there's no scaling, no infestations. You don't seem to have any hair loss. Your hair looks thick and nice and healthy. All right, now I'm gonna look at your fingernails. So I'm gonna palpate them, inspect them, and they look nice and healthy. We'll do the same thing with your toes. So I'm gonna palpate the toenails and assess their color, and they look okay also. All right, now we're gonna move on to your eyes. Do you have any problems with your vision?
Nope.
Okay, so I'm looking to check to see if your eyes are symmetrical, which they are, or if there's any abnormalities, which I don't see so far. Now I'm gonna palpate your upper and lower eyelids, so close your eyes. Okay, good. Now I'm gonna use my ophthalmoscope to look in your eyes, to look at the optic disc, which looks sharp. Good. Now I'm going to check your pupillary reflex, so I just want you to look straight at the wall. Good. Good, your pupils are nice and reactive. Now we're going to do the Snellen chart. So I want you to look at the chart over there, and you're going to read the letters line by line. And once you get to the point where you can no longer see, that's how we'll be able to tell if you have 20/20 vision or 20/30 or... So yours looks, we'll say yours is 20/20. Okay, now we're going to check your peripheral vision. So I want you to follow my fingers and tell me when you can no longer see them.
Nope.
Okay, great. Now I want you to follow my fingers. We're going to test your eye muscles. Ready? Great, okay. Now we're gonna inspect your nose. So your nares look symmetrical. I'm gonna use the otoscope to check. They look patent and symmetrical, no discharge. Do you have any problems smelling?
No.
Okay, good. Now we're gonna look at your ears. Ears look good. Any problems hearing?
No.
Okay, now I'm going to use my otoscope to look to see your tympanic membrane. And they both appear pearly gray, so that's good. Now we're going to do the whisper test. So I'm going to whisper in your ear, close, a little farther away, and then farther away in both sides. And tell me what you hear.
Dog. 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 Dog.
Okay, now we'll do the other side.
Dog. Dog. Dog.
Great. Okay, now we'll do the Weber's test. So I'll place the tuning fork on top of your head, and I want you to tell me if you hear the same volume in both your ears. Ding.
Yep.
Okay, great. Now we'll do the Rhine test. So I want you to tell me when you no longer hear the sound.
Done.
Same thing on that side.
Done.
Great, so it's equal on both sides. Okay, now we're going to look at your mouth. So can you open up? Great. It looks nice and pink and moist. So I want you to move your tongue to the left, to the right, up, down. So now we would test your gag reflex by taking a tongue depressor and moving it towards the back of your throat so that you would gag. We won't do that though. Okay. Now we're going to look at your neck. So I'm looking to see if there's any color discoloration or anything like that. And nope, your neck looks good. Okay, now we're going to check your sinuses. So I'm going to palpate here and here. Great. I'm gonna first palpate your temporal arteries, and then I'm gonna listen using my stethoscope. Good. There's no bruit, +2. Okay. Now I'm gonna check your thyroid from behind you. Okay. Now we're gonna assess your lymphoids. Touch right here. Clavicular, axilla. Okay, great. Now we're gonna move on to the cardiac system. So I'm gonna have you lie down with your head slightly up. So we're gonna measure your JVD with this ruler. So you are about 3 centimeters, so that's good. Okay, and while you're lying flat, we're gonna check your femoral artery right here and right there. Okay, great. You can sit up. Okay. Now we're gonna check your carotid artery. Good. We'll check your brachial artery. Brachial, radial. We'll check your popliteal, which is right behind your knee. Same thing over here. And then your DP on top of your foot and your PT on the outside of your ankle. And we'll do that on both sides. Okay, now we're gonna listen to your heart sounds. So first we're gonna use the diaphragm of the stethoscope to listen for S1 and S2 at all the points, and then we'll listen to the same thing but using the bell for any abnormal heart sounds. So we're gonna listen to at the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. Now we're gonna do the same thing with the bell. Great, I hear S1 and S2 and I don't hear any murmurs or anything like that. Okay, great. Do you have any chest pain or anything like that?
No.
Okay, now we're gonna listen to your arteries. So I'm gonna listen to your aorta artery, your renal artery, iliac artery, femoral artery, and femoral artery. Okay. Now we'll move on to the respiratory system. Do you have any problems breathing?
No.
Okay. I'm gonna check your pulse ox using this machine. So I'm gonna place it on your finger and it'll tell me your oxygen saturation. Great. Now I'm gonna listen to your lungs from the front using my stethoscope. So take deep breaths. Now we'll do the same thing from the back. 1, 2, 3, 4, 5, 6, 7, 8. Okay, great. Now we're going to do the same thing and I'm going to listen while you say the number 99, okay?
Mm-hmm.
Ready? Go.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. Now I'm going to percuss in the same areas that I just listened to.
99.
Oh, you don't have to say 99. Great. Your lungs sound resonant. Okay, now I'm going to check your capillary refill in your fingers. Good, less than 2 seconds. Good, less than 2 seconds. Now we're going to do the same thing but on your toe. So I'm pressing down, less than 2 seconds. Same thing on this foot, less than 2 seconds. Okay, now we're going to look at your GI system. So can you lie back down? So first we're going to look at your abdomen. Good, it looks soft, non-distended. Now we're gonna osculate the abdomen. So I'm gonna listen at all 4 quadrants. 2, 3, 4. Okay, good. Vowel sounds sound active. Okay, now we're gonna percuss at each in a zigzag form, so 3 in each quadrant. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Great. Now I'm gonna lightly palpate using one hand. 1, 2, 3, 4. Great. So now if I want to do deep palpation, I would use 2 hands doing the same motion. Okay. Do you have any problems eating?
No.
No? Okay. You can sit back up. Okay. Now we're gonna go to the musculoskeletal system. So we're gonna do your neck first. So can you move your neck back, forward, left, and right. Now we're going to do the same thing. So move your head to the left against resistance. Now to the right. Great. Now we'll do your shoulders. So can you lift your shoulders? Can you lift your right arm up? Great. Now down. Can you bring it back behind you? Great. Now bring it out to the side. Good. Now down. Good. We're going to do the same thing over here. So up, down, behind you. Okay, bring it back. Now to the side, back. Now I want you to shrug your shoulders up. Okay, good. Now against resistance. Great. Now we're gonna move on to your elbow. So I want you to flex, extend. Okay, we'll flip your wrist and rotate it back. Great. Now you're gonna I want you to flex against resistance. Good. And extend against resistance. Good. We'll do the same thing over here. So flex, extend, rotate, rotate. Flex, extend. Okay, good. Now we'll do your wrist. Keep your arm up here. So I want you to flex it up, extend it down. Can you rotate it? Great. So flex it up. Good. Flex it down. Good. We'll do the other hand now. So flex up, down, rotate, rotate, up, down. Okay, great. Now we're going to do your hips. So I want you to lie in the bed on your back. Okay. So I want you to put your left hand up, left leg up. Good, and down. Right leg up and down. Now we're going to do the same thing against resistance. So up, down, up, down. Okay, now we'll go on our stomach. So we'll do the same thing. Up, down, up, down, up, down, up, down. Great. Okay, now you can go back on your back. And we're gonna focus on your knees now. So I want you to bring your left knee up to your chest and down. Your right knee up to your chest and down. Same thing. Good. Same thing. Good. Now I'm gonna have you sit at the edge of the bed. Okay, now I want you to, can you bring your legs up? Good, and down. Now extend your legs so they come out straight. Perfect. Now down. Now the other one. Great, now we're gonna do the same thing but with resistance. Up. Good. Up. Good. Okay. Great. Now we're going to check your ankles. So I want you to bring your ankles. Can you bring your ankle pointed up, down, rotate it inward, outward? Great. Can you curl your toes and straighten them out? Great. We're gonna do the same thing with this foot. So up, down, inward, outward. Curl your toes, straighten your toes. Good. Now I want you to push up against me. Good. And push down. Good. Push down and pull up. Great. Now we're gonna check your spine. So I'm gonna have you stand up. Okay, so I want you to bend over. Great. And now stand up. And now lean backwards. Great. And now I want you to lean to your left side and then to the right. Great. Now can you rotate and then rotate to the other side? Great. Okay. You can sit down. Okay. Okay. Now we're going to move on to we'll work on your neuro system. So I want you to smile, frown, clench your teeth, open your jaw, close your jaw, stick out your tongue. Great. Can you raise your eyebrows? Okay, perfect. Can you puff out your cheeks? Great. Now I'm going to touch your face with something soft and then something dull. It's hard. And I want you to tell me which it is. So close your eyes.
Soft. Hard.
Great. Okay. Now we're going to move on. And we're going to do the same dull and sharp, but on your arms and legs, okay?
Soft. Soft. Hard. Hard.
Okay, great. Now we're going to have you, you can lie back in bed. And I want you to take your heel and rub it against your leg. Great, now do the other leg. Great, now can you touch your finger to your toe, to your nose? Okay. You can let go. Okay. Now we're gonna test your short-term memory. So I'm gonna tell you 3 words and then I want you to remember those 3 words. Red, cat, truck. Okay, 5 plus 5.
10.
2 plus 2.
4.
3 plus 3.
6.
What were the 3 words I told you?
Red, cat, truck.
Great. Now we're gonna test your long-term memory. So where were you last Christmas?
At my aunt's house.
Great. Okay. Now I'm gonna write a number on your hand and I want you to tell me what the number is without looking.
1.
Great. Now next I'm gonna place a common household object in your hand and I want you to tell me what it is without looking. So close your eyes.
Tape.
Great. Okay. Now I'm gonna have you walk across the room. Great. Now can you walk back to me but do it heel toe? Okay. Now walk the other way on your tippy toes. Now walk back to me on your heels. Okay, great. You can have a seat. Okay. These questions might sound silly, but I have to ask everyone. Do you know your name?
Michelle.
Do you know where you are right now?
A doctor's office.
Do you know what the year is?
2019.
Do you know who the president is?
Trump.
Okay, great. Do you have any questions for me?
No.
Okay, thank you for doing the assessment with me.
Thank you.